In this video, I will discuss coffee dosages. The main active ingredient in coffee is caffeine. 99% of orally ingested caffeine is absorbed. Caffeine is soluble in water and oil and readily crosses the blood-brain barrier. Peak plasma levels are obtained in 15 to 45 minutes. A 6-ounce cup of brewed coffee usually has anywhere from 80 milligrams to 175 milligrams of caffeine. And tea generally contains between 50 milligrams to 100 milligrams of caffeine. The half-life for caffeine metabolism is typically 5 to 6 hours in an adult. This means that 12 hours after your last cup, you will still have some of that caffeine still exhibiting its effects and blocking your ability to feel how tired you really are, and interfering with the sleep process. Caffeine increases brain metabolism by interfering with the work-rest cycle of neurons. Aside from an increase in adenosine receptor numbers, there is little tolerance or adaptation to this effect. Tolerance is seen for blood glucose elevation via caffeine. Tolerance for blood glucose elevation simply means that as you grow accustomed to caffeine, it doesn't elevate your blood sugar so much. But this effect is reduced or not observed in obese individuals or those suffering from type 2 diabetes. Caffeine can also kill you. The lethal dose is 150 milligrams to 200 milligrams per kilogram of body weight, but this is subject to high individual variation. So much so that caffeine pills of just 2 grams have been lethal. Personally, I stay away from any isolated or concentrated caffeine source. I advise against energy drinks, espressos, fat burners, caffeine pills, or the like, because they deplete your body and because they can actually kill you. I make coffee with a coffee machine and I always use paper filters. I use an Arabica blend for its lower caffeine content, and I avoid espressos, instant coffees, or other highly processed forms of caffeine. I never use energy drinks or caffeine pills. I use 1 level teaspoon of coffee in 1 cup of water. Note, I do use other caffeine-containing products, mainly green tea, but the total formula is balanced to offset caffeine's negative effects. One last interesting thing to remember. Reducing steeping time reduces caffeine content in brewed coffee and tea. What this means is a coffee machine is better than brewing your own coffee on the stove, because the resulting coffee contains less caffeine. In this video, we have discussed coffee dosages and a little bit about how to prevent problems associated with coffee use. If you want to learn more interesting things about coffee, then go to damianalexander.com/coffeepdf. If you want to learn more about critical nutritional supplements, life extension, and disease prevention, then subscribe to my YouTube channel at Damian Alexander's Vids. Lastly, discover the easiest and shortest way to double physical and mental energy, strengthen immunity, and restore health by visiting howtochangeyourOwnbatteries.com.